Hello, everybody. Thank you for joining today's webinar, The Future of the Affordable Care Act. I am Catherine Martucci, Director of Policy and Programs at the Alliance for Health Policy. For those who are not familiar with the Alliance, welcome. We are a nonpartisan resource for the policy community dedicated to advancing knowledge and understanding of health policy issues. I want to take a moment to thank the Commonwealth Fund for sponsoring this event, and to encourage everyone to join today's conversation on Twitter using the hashtag AllHealthLive. We also want you to be active participants in this discussion, so please get your questions ready. You should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. And you can use that speech bubble icon to submit questions you have for the panelists at any time. We will collect these and address them throughout the broadcast. And if you're experiencing any technical issues, you can also chat about those. And please be sure to check out our website, allhealthpolicy.org, where you can find background materials that accompany this presentation, including slides, a resource list, an expert list, and speaker bios. And then we will also include a recording of today's session there soon. And then finally, I wanted to highlight an upcoming event, our post-election symposium that'll be taking place next week on Tuesday, November 17th and Wednesday, November 18th. We have gathered a wonderful range of experts, including Chris Jennings and Mark McClellan, to discuss how the election results could influence the health policy agenda next year and beyond. So now I'm so pleased to introduce Dr. Elizabeth Fowler to moderate today's discussion. Dr. Fowler is Executive Vice President of Programs at the Commonwealth Fund. Prior to joining the fund, Dr. Fowler was Vice President for Global Health Policy at Johnson & Johnson. She also served as a Special Assistant to President Obama on healthcare and economic policy at the National Economic Council. Dr. Fowler, I'm very pleased to be leaving this discussion in your expert hands. Thank you so much for joining us.
Liz, I think you're muted.
Okay, sorry about that. You'd think after 8 months we'd all get the hang of this, but apparently not. So thank you, Catherine. It's a real pleasure to moderate this panel today. On Tuesday, the Affordable Care Act was again before the Supreme Court for the third time. This time, 18 Republican attorney generals and governors, led by Texas, the Trump administration, and 2 individuals urged the court to strike down the entire law. 21 Democratic attorneys general and governors and the U.S. House of Representatives defended the law. In a nutshell, the Republican states are arguing that the ACA is unconstitutional because Republicans in Congress eliminated the penalty for not having health coverage in 2017 as part of the tax reform bill. And that's relevant because you might recall in 2012, the Supreme Court upheld the ACA as a mandate, the ACA's mandate as a tax. Without the penalty, is it still a tax? And if it's not a tax, is it unconstitutional? Or is it constitutional? And they argued that if the mandate is unconstitutional, the whole law should be struck, not just the mandate or the parts of the law impacted by the mandate. It's a bit of twisted logic, which is why there were lots of questions about congressional intent, whether the mandate is a necessary part of the law, and whether anyone's actually harmed by a $0 penalty. We also revisited a requirement to eat broccoli, a new requirement to fly flags and mow lawns. We heard questions about commands versus choices, and many of us had to look up the word precatory. Here with me today is a group of esteemed experts who will help us understand what happened on Tuesday and the possible outcomes in the case, the potential impact on the health system and patients if the court agrees with the Trump administration and Republican states, and specifically what might be the impact on communities of color and health equity more broadly. First, we have Katie Keith, a principal at Keith Policy Solutions and an adjunct professor at Georgetown University Law Center, where she teaches courses on the Affordable Care Act and LGBT health law and policy. Next, we'll be joined by Dr. Sarah Collins, Vice President for Health Coverage and Access at the Commonwealth Fund. In this role, Dr. Collins has led several national surveys on health insurance and authored numerous reports, issue briefs, and journal articles on health insurance coverage and policy. Next, we have Jamila Michener, Associate Professor of Government at Cornell University, where she studies poverty, racial inequality, and public policy. Dr. Michener authored Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. And she's co-director of the Cornell Center for Health Equity, as well as co-director of the Politics of Race, Immigration, Class, and Ethnicity, or the PRICE Initiative. And finally, we're joined by Mr. Tom Barker, partner at Foley Hoag and co-chair of the firm's healthcare practice group. Prior to joining the firm, Mr. Barker served in several senior level positions at the Center for Medicare and Medicaid Services and the U.S. Department of Health and Human Services during the administration of President George W. Bush, including General Counsel of CMS, Counselor to the Secretary of HHS, and General Counsel of HHS. So a great lineup. I'm really looking forward to this discussion. Thank you for being here with us. And Katie, I'll take it, leave it. Let's start with you.
Great, thanks, Liz, and thanks to the Alliance for having me. It's been quite a 2 weeks, if you will. So maybe we can go to the next slide. And I think Liz did a great overview here. I won't revisit this too much. You can sort of see who the parties are in this litigation, which is called California v. Texas. This is all about the individual mandate and whether without a penalty, the mandate is still constitutional or not. But the kicker is if the mandate is unconstitutional, how much of the rest of the law is allowed to stand or fall with that mandate. So we did have oral argument on Tuesday. In terms of timeline, a decision is not expected until 2021. It could come as early as this spring. Myself and probably many others are expecting this, that we'll probably see something towards the summer, towards the end of the court's term in June of 2021. So nothing to do now. We're sort of watching and waiting now that oral argument has closed. Next slide, please. So one of the things that makes California v. Texas quite complicated to talk about or even think about is there really are a range of different outcomes that we could see. So again, the case is, at its core about the constitutionality of the mandate, but when you get into this concept of severability, you're really asking how much, if any, of the rest of the law should be struck down alongside the mandate. And so the question that the court has to answer, which we heard a lot about on Tuesday, was which provisions of the ACA is the mandate so essential to that they also have to fall alongside it. And so the court is the one who's going to draw that line. They look to congressional intent. They have to answer a number of questions. But at the end of the day, the court decides how much of the rest of the law stays or goes. And so the way to think about California v. Texas is really as a spectrum of outcomes. So, there are a range of decisions that the court could make that would very much maintain the status quo. They could find that those two individuals or the coalition of states led by Texas don't have what we call standing to sue. They could find that the mandate is constitutional and completely uphold it, or they could find that the mandate is unconstitutional but fully severable from the rest of the law. Any one of those outcomes would really maintain the status quo. Functionally, we've been without an individual mandate since 2019. The sky has not fallen. Justice Alito gave a very creative analogy to a plane flying through the sky, where we thought the individual mandate was a really important piece of machinery to that plane as it flew from the sky. We've now taken out that piece of machinery and we're still flying along. So any of that, we would sort of be in the same world with the status quo. That said, we could see some disruption. So the court might decide that parts of the ACA are, so essential to the mandate is so essential to those parts of the ACA that they also have to fall. So they could strike only the pre-existing condition provisions for the Affordable Care Act, what we technically call guaranteed issue, community rating, core provisions that really do protect people with pre-existing conditions in all 50 states. They could say those need to go. They could go broader than that. They could strike down all of Title I of the Affordable Care Act, which is focused on those core insurance provisions. So the marketplaces, risk adjustment, everything that we sort of think about as core Obamacare provisions. Maybe they say that the mandate's essential to all of those and should also be struck down. The most extreme decision, of course, would be to say that the entire Affordable Care Act, all 1,000 pages, whether it touches on Medicaid expansion or biosimilars or Medicare or the whole range of policies included in this big broad statute, they could conclude that the mandate is so essential to all of those programs and all of those laws that the entire statute is invalidated. Most experts, including myself, think that is unlikely, but it is still possible, and so something that it's important to take seriously, at least for now. So those are the outcomes. Next, I'll just talk a little bit about what we heard on Tuesday. Next slide, please. Oh, perfect. So if you listened, and I encourage everyone here, it's unique that because of the pandemic, we're able to listen in to oral arguments from court. Fascinating how this goes. So I would encourage folks to actually listen. It was about a 2-hour oral argument. There were a ton of questions on the issues of standing. So whether those 2 individuals in Texas were actually injured by the individual mandate. I think the question is, how in the world does a $0 penalty harm anyone? And I think the justices suggested, several of them were troubled by this idea. There's also a big focus on something called standing through inseverability, which I'll hold off. And if we want to dive deep in the questions, we can do that. There were also a lot of questions about constitutionality of the mandate. And, you know, in light of the 2012 Supreme Court decision, is a $0 penalty? Does this still look like a tax? Is it a command to buy health insurance? All those questions. Really interesting discussion, pretty technical and wonky. And even from my takeaway, I couldn't see a clear consensus on how the court's going to rule on those issues. That said, and what I think is some positive news for the law, of course, you can never tell from oral argument, but what I think was good was on the issue of severability. And so for the ACA to be upheld, you need 5 justices, at least 5, to vote to uphold the ACA. And it seems like, based on some simple math, there seemed to be support from a majority of justices that the ACA, even if the individual mandate is unconstitutional, that the mandate is what we call severable from the rest of the ACA. So some of the questions, and I've got some key quotes, particularly from the Chief Justice and Justice Kavanaugh there, both their questions and comments seem to make very clear that they were skeptical about the arguments that Texas in particular is making here. The Chief Justice saying, you know, it seems really compelling that Congress amended the penalty and left the whole rest of the statute in place. At another point, he suggested, I think Congress wants us to strike down the law, wants us to repeal the Affordable Care Act, quote, but that's not our job. Justice Kavanaugh there saying, I tend to agree with you. It's a very straightforward case for severability, meaning we would excise the mandate and leave the rest of the act in place. So some strong examples, and I think you don't normally get that from oral argument. Tom and others should jump in. Oftentimes you're sort of left with this feeling of, well, you know, these questions suggested that they're thinking this. I look at the statements that you have on your screen in front of you and think, you know, it seems pretty clear what direction at least those 2 justices are going to go in. And so at a minimum, we'll see what they say on standing and constitutionality. I would like to think that they will, you know, sever the individual mandate from the rest of the ACA if it is unconstitutional. Maybe the last point on that is it should not be surprising if they do that. This case is generally considered to be the weakest legal challenge to the Affordable Care Act, and you've had a number of ideologically diverse legal scholars come out and really question this case, and many agree that it's very weak. It shouldn't be a surprising outcome, and I think I was just maybe heartened to hear that the court was going in that direction. But again, anything can happen. So I'll stop there. I'm looking forward to the discussion and your questions, and we'll turn it back over to Liz. Thanks.
Thanks, Katie. That was excellent. Really captured what happened. Over to Sarah.
Sarah, if you're talking right now, I think you're muted.
Sorry, very sorry about that. Thank you, Liz and Katie, and also the Alliance for hosting the webinar. I'm going to briefly highlight the implications of hold on one second. Oops. Okay. Can everybody hear me?
We can, thanks.
Yes.
Yep,
Okay, great. Thank you. Sorry about that. Anyway, I'll focus on the potential implications of the three possible areas of three possible outcomes that Katie laid out, and with a particular focus on coverage, insurance coverage. Next slide, please. So if a majority of the justices decides that either the plaintiffs don't have standing, that the individual mandate is constitutional, or that the mandate is unconstitutional but severable from the rest of the Affordable Care Act, the ACA will pretty much continue to operate as it does now. The individual market in particular is functioning pretty well right now without the penalty. A loss of the mandate itself would have probably little or no additional effect. Insurers are viewing the premium subsidies in the marketplaces as a sufficient incentive to attract enough people, including healthy people, to maintain a stable market. If that had not been the case, zeroing out the penalty would have caused premiums to spike as healthy people left the market, and insurers would have left too. But the opposite has really happened. The Trump administration announced in October that premiums for plans sold through healthcare.gov fell by 8% in the 3 years since the penalty was zeroed out, and the number of participating insurers actually climbed. Next slide, please. Under a scenario where a majority of the justices decide that the mandate is unconstitutional and is not severable from the individual market reforms, so as Katie mentioned, the pre-existing condition protections, that group of reforms that are most closely linked to the mandate, the individual market will look much like it did before the Affordable Care Act. People with health problems who try to buy coverage on their own would face a lot higher premiums, have their conditions excluded from their plans, or be denied coverage entirely. Young women, older people, smokers would face substantially higher premiums or be unable to get covered at all. Few health plans, if any, would cover maternity care or maybe at a very high cost. Insurers and employers could place annual and lifetime benefit limits on the amount of healthcare that they'll pay for, leaving people potentially exposed to catastrophic healthcare costs. Insurance companies could rescind or cancel policies if somebody became sick. Next slide, please. Under the scenario where a majority of justices decides the mandate is both unconstitutional and inseverable from the entire Affordable Care Act, we would see massive disruption in insurance coverage and billions of dollars in revenue losses from states and providers. The Urban Institute estimates that about 21 million people would become uninsured. This is in addition to the current estimate of about 35 million uninsured. 15 million adults and children who have coverage through Medicaid and the Children's Health Insurance Program would probably lose their insurance. 15 million people who have individual market coverage, including 9 million that have subsidies right now, would lose their insurance. More than 150 million people with employer coverage would no longer be entitled to free preventive care and the ability to keep their children on their policies until age 26. States would lose an estimated $152 billion in federal funding for healthcare. Healthcare providers and manufacturers like pharmaceutical companies would lose an estimated $135 billion in revenues. Uncompensated care would increase by an estimated $58 billion as more people became uninsured. Next slide, please. Also under this scenario, uninsured rates would rise significantly across all racial and ethnic groups, reversing improvements that have been made under the Affordable Care Act. The Urban Institute projects that the uninsured rates would rise to 30% among Hispanic people, 24% among American Indian and Alaska Natives, and 20% among Black people. Exhibit 5. Next slide, please. But the implications of overturning the Affordable Care Act will extend far beyond the law's coverage expansions. The healthcare industry represents nearly 20% of the nation's economy. The ACA has touched nearly every corner of it. The law restructured health insurance markets. It streamlined the Medicaid program. It improved Medicare benefits. It reformed payment structures in the delivery system, for example, by changing the way Medicare pays providers, by creating a catalyst towards value-based care, establishing a regulatory pathway for biosimilars. Insurers, hospitals, physicians, state and local governments have invested billions of dollars in adjusting to these changes. So in short, the justices are not only considering the fate of the Affordable Care Act, but really the fate of the entire healthcare system in this case. Thank you.
Thanks, Sarah. Really compelling. That was great. Now over to Dr. Jamila Mishner. Jamila?
Hello, everyone. I am going to focus today on the implications of this case for health equity, and specifically I'm going to emphasize racial equity. You know, it's really helpful to hear the various scenarios laid out. And while I agree that the complete overturning of the ACA is the least likely scenario, it's the scenario that I'll focus more on today because it's the one with the most striking and the starkest implications for racial equity. And should somehow that turn out to be what happens, it's worth sort of having at the forefront of our minds what it means specifically for the health and well-being of people of color in this country. Next slide, please. Just a little bit to sort of provide some context for the urgency of thinking about health equity, specifically with respect to race and ethnicity in this context. We're clearly living through a pandemic right now that is having disproportionate effects in communities of color and devastating Black, Indigenous, and Latinx populations. And so it's important anytime we think about essentially any facet of health policy, but certainly about a massively important piece of legislation like the ACA, to consider its racial equity implications. Next slide, please. So just a few things to keep in mind with respect to the ACA and racial equity. What information we do have, for example, from the Center for Budget and Policy Priorities, suggests that the ACA being repealed or overturned in any way would cause a large, large coverage losses, and that those coverage losses would affect everyone negatively across racial groups, but disproportionately would have negative effects on racial minorities, right? So if we think about, for example, the widening of gaps in terms of the uninsured rate, we could see the kind of differences under the ACA versus what we might expect or project after the ACA was no longer in effect. Again, that would be the most striking outcome from this case, and it's the least likely outcome, especially given what we heard, given some of the questions and concerns that emerged in oral arguments. And so that was a bit comforting, but I think it's still important to sort of keep in view what the stakes are here, especially with respect to racial equity. One of the reasons for that gap in coverage loss has to do, primarily with the impact of the Medicaid expansion piece of the ACA, right? So under a scenario either where the individual mandate is declared constitutional and we move on with the status quo, or the individual mandate is declared unconstitutional but severable, and we essentially move on with the status quo. But even under the kind of slightly more striking scenario where the individual mandate is declared unconstitutional and inseverable, but only from those sort of market-oriented aspects of the ACA, Medicaid would still remain untouched. So it's only in the kind of most extreme scenario where the mandate is considered unconstitutional and inseverable from the entire ACA that we see that Medicaid would be affected. And if that happened, that's where most of the kind of the declines as far as the racial equity gains that we've seen under the ACA, that the source of them would come from the losses with respect to Medicaid expansion. Next slide, please. And we know that the implications of Medicaid expansion for racial equity have been quite striking. And we can tell this because we are able to look at expansion states, compare them to non-expansion states, and track what the implications of expansion have been across various racial groups across these two categories of states, right? So we know, for example, that the uninsured rate has dropped more precipitously in particular for Black and Latinx populations in expansion states relative to non-expansion states. We know, in addition, that things like the share of adults that report avoiding Medicaid medical care due to cost has also dropped more steadily in expansion states versus non-expansion states, and decreased in ways that have disproportionately benefited Black and Latinx populations, to the extent that fewer of them are reporting avoiding medical care due to cost. One of the ways that Medicaid emerged, I thought quite interestingly in the oral arguments, came through the Texas Solicitor General Hawkins, who explicitly made the case that if the sort of force of law, without any penalty, if simply the force of law, you know, via some form of suasion, were to cause someone who realized that the law says that they should have health insurance to sign up for Medicaid, the Solicitor General made the argument that even if even one person signs up for Medicaid, and if the state spends even $1 as a result of that, and that can be linked to the mandates despite it not having any penalty, that would represent a cost that would at the very least give the state of Texas standing, right, to bring these claims around the mandate and its unconstitutionality. And that's an argument that, you know, is a distinct argument from severability, but really it was striking to see Medicaid being used as a basis for claiming that there was going to be some sort of cost related to a zero penalty insurance mandate. And so even in the sort of substance of the oral arguments, there was an attempt to use Medicaid and the somewhat, you know, and the supposed possibility that the mandate could cause people to sign up for Medicaid who otherwise wouldn't have, that was used as a basis for making this case, right? So Medicaid remains central even in the arguments themselves. Next slide. And it's also important to think about Medicaid expansion and its ripple effects, especially when we're thinking about this through the lens of equity, beyond simply, you know, things like the rates of people who are insured, and even directly issues related to medical care or seeking medical care, because Medicaid's ripple effects go far beyond this, whether it's with respect to uncompensated care, which, you know, has decreased, has been reduced under Medicaid expansion, and were Medicaid expansion to no longer to be the law of the land, and we saw that the cost for uncompensated care tick back up, that would have implications for the entire healthcare system, right? And specifically for those parts of the system that served folks that are at the economic and racial margins, right? And those parts of the system would then be more stretched and would be under more duress without Medicaid expansion providing the dollars that it's now providing. And even outside directly of the healthcare system, if we think about things like evictions, which we've seen research that suggests a relationship between a decline in evictions and Medicaid expansion, right? And in part, this is because Medicaid expansion is doing things like alleviating the burden of medical debt, right? For low-income Americans and disproportionately for Black and Latinx Americans who are in that low-income category. And so there are all sorts of mechanisms by which, whether on a system-wide level through something like uncompensated care, or on an individual level by alleviating medical debt and providing people with more economic stability so that they end up being able to avoid outcomes like eviction, Medicaid has a wide range of ripple effects. And were it to ripple effects that directly relate to equity with regard to socioeconomic status and race. And were we to see Medicaid imperiled by the outcome of this case, we would have to contend with these ripple effects. Under that kind of scenario, I would expect, for example, that some states to be responsive and to attempt to take actions to sort of stem the bleeding that this would cause, honestly, in the healthcare system, but they would be limited in their ability to do so. And there would, of course, be some subsets of states that did not take action, right? And so we would see increasing geographic fragmentation in terms of who had access to what resources. And some of that fragmentation, the Affordable Care Act has helped to provide a basis for reducing. So I'll stop there and turn the mic over.
Thank you so much. That was so in-depth and really compelling. Turning over now to Thomas Barker. Thomas.
Thank you, Liz, and thanks very much to the Alliance, and thanks everyone for your attention today. So I have, I believe I have a chart that shows likely outcomes, if we can bring that up.
Sorry, Tom, I don't think we have that chart, but we will make sure that the audience can get access to it after the fact.
Yeah, I sent it yesterday.
Okay, apologies about that.
Okay, so I was going to start off by saying that if I had any technological skills, I would have done a chart that was on one page, but it was on 3 pages. So just to sort of visualize, the way that I had this chart was on the x-axis, I had the various outcomes, the potential outcomes, and Katie did a really great job talking about the potential outcomes. And then on the y-axis, I had the various parties and how they might respond. So to start, to just again run through really quickly the potential outcomes. So the first potential outcome would be that the Supreme Court determines that the parties lack standing. Second potential outcome, Supreme Court finds that the individual mandate is unconstitutional but severable. Then the Supreme Court invalidates either Title I or at least those provisions that are linked to the mandate. And then, as Jamila just said, the most dramatic and draconian possibility is that the Supreme Court finds the individual mandate unconstitutional and inseverable. And so then, again, on the y-axis on my chart, I had the various parties. So the various parties being the Trump administration, the Biden administration, Congress, and the states. So let's just sort of walk through how the parties might respond to each of those scenarios. So Liz, I think it was Liz that mentioned this at the outset, that it seems highly unlikely that the Supreme Court is going to decide this case before June, probably the end of the term. But and so if that's the case, then obviously the Trump administration is not really going to take any action. But if by some chance the Supreme Court decided this case by January 20th, the 4 potential outcomes. So it seems to me if the Supreme Court upholds dismisses because of lack of standing, or that they find that the individual mandate was unconstitutional but severable, not clear to me what the Trump administration could do. I mean, maybe the president could send some angry tweets that the Supreme Court rejected a position that the administration had urged them to take, but I don't see that there's much else that they could do. It seems to me the only point that I want to make about the Trump administration, it does seem to me that if the Supreme Court were to find that the entire act were unconstitutional, it is sort of ironic that the administration would lose its ability to use some of the provisions of the ACA that it's relied on to implement changes in the healthcare system that it supports. So, for example, the president's proposal on drug pricing to implement the International Pricing Index relies on CMMI. Well, if the ACA is entirely unconstitutional, CMMI has to go, and therefore its own proposals would be invalidated. So, in any event, I think that's the least likely to occur, just because I don't think the Supreme Court will act by January 20th. So what does the Biden administration do then if the Supreme Court acts between January 20th and the end of June? So if they dismiss based on lack of standing or because they find that the mandate is severable, well, there's probably not much the Biden administration really needs to do. Obviously it gives them the ability to issue statements of support for the ACA, the need for the ACA, and perhaps President-elect Biden, of course, campaigned on the need for a public option to compete with private insurers on the exchanges, and it would potentially give the administration a talking point along those lines. But it doesn't seem to me that they really need to do anything. By contrast, if the Supreme Court were to strike down the mandate and hold that it at least requires striking down Title I, it seems to me that they would need to do something. Perhaps they could encourage Congress to reenact the Section 5000B penalty for failure to have health insurance, or at least enact a nominal penalty to preserve the taxation basis for the mandate. Katie mentioned that the Supreme Court upheld the mandate in NFIB v. Sebelius on authority of Congress's taxing power. They could also and of course, if the entire act was struck down, they could encourage Congress to enact the penalty again. It seems to me that that's the same outcome. So turning to Congress, I don't think Congress would need to do anything, again, if the Supreme Court upholds the law or finds that the mandate is severable. But I do think if Title I were invalidated, or if the whole act were invalidated, it seems to me Congress would need to do something there. But I also think that given the makeup of what Congress is likely to look like next year, I find it very difficult to believe that they would actually reenact the penalty. But I think they could make tweaks. So for example, if the link between the mandate and pre-existing condition exclusions in the individual market were struck down, it does seem to me, at the very least, there does seem to be bipartisan support for enacting some type of federal prohibition on pre-existing condition exclusions in the individual market. They could at least do that. Hard for me to see how if all of Title I were struck down, which includes not just the insurance reform, but it also includes establishment of the exchanges, the subsidies for exchange plans, the employer mandate. It seems to me that it would be very difficult politically to reenact those. So I think probably the only thing that Congress would be able to agree on would be some type of federal restriction on pre-existing condition exclusions. How would Congress react if the entire act was struck down? To me, and I agree again with a comment that Shamila made in her presentation, that it would really have a significant impact on the American healthcare system. That would go far beyond Title I, and it would affect Medicare, Medicaid, public health programs, 340B. Congress would probably reenact significant provisions of those. It probably wouldn't, I can't imagine it would reenact the Medicaid expansion, but many of the ACA provisions that would be struck down if the whole act were invalidated, I suppose that that they could reenact parts of the ACA. And then my last comment, my last party, I'm sorry, is how would the states respond? So again, no action necessary if the Supreme Court upholds the ACA or finds the mandate severable. But it seems to me that if the Supreme Court were to invalidate Title I and the provisions related to the mandate, states would need to consider whether or not those states that prior to the ACA did not have pre-existing condition exclusions would have to enact them. And so that, it seems to me, would be a possibility. Some states, I guess, could create their own exchanges and possible subsidies, but it seems to me that would be very difficult, especially in these days of COVID, when states are facing serious and significant difficulties with financing. I think it would be very difficult to see how a state would really be able to enact subsidies. And I guess some states might also enact employer mandates. A handful of states pre-ACA did have employer mandates. And then the last possibility, full invalidation of the ACA, how would states to act? Obviously, a state could not reenact Medicare provisions. They can't affect the 340B program. A state generally can't regulate ERISA plans because of the ERISA preemption clause. States would have to, though, it seems to me, evaluate how they would cover childless adults and parents, and also deal with the loss of the enhanced FMAP that would go away if the ACA was invalidated. How would they deal with that? So I think that would be a significant concern as well. So that's sort of how I had thought about this, the potential scenarios and how the various relevant parties, Trump administration, Biden administration, Congress, and the states would react. So maybe let me stop there, and we can now open it up for questions. I believe, Liz, let me turn it back over to you maybe.
Yes, thanks. Wow, that's a lot of dominoes that would fall. And so thanks to all the panelists for this background and analysis. Let's move on to the Q&A discussion. Remember, for those in the audience, you can use the questions panel of the audience interface to submit your questions at any time. I'll start out with a couple of questions. And for those of you who sent them in already, here's a question for Katie. Did Amy Coney Barrett, as the newest Supreme Court justice, signal during oral arguments how she's leaning on the mandate or on severability? What did we hear from the newest justice on the court?
It's a great question. Thanks, Liz. I didn't get a strong sense. She asked great questions. I can, off the top of my head, I can think of a few focused on standing, which again, a lot of the justices were quite interested in, and I got very technical. A couple on standing. She was also interested in Congress's intent, and posed a few questions that come to mind about, you know, could Congress be enacting a law that it knows is unconstitutional? Sort of this idea of like hiding, did they intend for this to go back to the court and then have the court sort of strike everything down by relying on the decision in NFIB to, you know, convert this tax provision now into an unconstitutional command? She posed a series of questions to sort of ask about, could Congress have really done that, or did it rely on the construction in NFIB? So I didn't get a strong sense from her. It certainly wasn't along the same lines as what I showed earlier from, you know, Justice Kavanaugh or the Chief Justice. I will, you know, remind folks, before she was under consideration for the Supreme Court, she participated in a moot court. There's only so much you can take from that, but she disclosed during her confirmation hearing that she had voted that the mandate was unconstitutional but fully severable, meaning the entire rest of the law would stand. So not a lot of tea leaves to read there, unfortunately. I wish I had something, you know, brighter to give or better insight, but, you know, sort of just normal questions like everyone else.
Well, that's some nice color. Maybe this is to Sarah and some others. If the law was invalidated and 20 million people really did lose their health coverage, would you expect cost shifting by providers from uninsured to insured populations? And would there be any change in source of care for the newly uninsured? Anyone? Sarah, I know you're probably the best person. Others, please feel free to jump in. Oh, you're on mute.
We would really go back to the pre-ACA world if people can remember what that was like, you know, 10 or even 6 years ago, when a lot of people didn't have insurance coverage yet because the reforms hadn't all been rolled out. So it is very difficult for people who don't have insurance coverage to get access to healthcare, and when they do, that becomes an uncompensated care burden. For them, people are left with bills, but if they can't pay them, they're left to providers to pay them, and that's why the Urban Institute is expecting about $58 billion increase in uncompensated care under that scenario. So would really be catastrophic in terms of access, and we'd be at much higher levels of uninsured. Even if there are 35 million people currently uninsured, and you add 20 million more, we're actually at a higher level of uninsured than before the Affordable Care Act passed. So pretty catastrophic.
I just add to what Sarah said. I agree with everything Sarah said. I just add, it would also, not only would it have an effect on uncompensated care for providers, it would also affect DISH, both Medicaid.
Uh-oh. I think Tom is somewhat frozen. Is he frozen for others?
Yes, I think Thomas is. If you want to continue, and I'll send
Thomas,
it back.
Okay. So, and I was going to refer back to Thomas's points about what Congress might do and how Congress might respond if either part of the ACA or the whole ACA was struck, and that has to do with pre-existing conditions. Could you see a scenario where Congress could just reinstate pre-existing conditions without looking at other measures, the subsidies, the risk adjustment, the marketplace, and all the other protections? It would seem like they would need to do more than just reinstate pre-existing condition protections if the law was struck. Katie, it looked like you were going to speak.
I can, and maybe if Tom's back, he can jump in too. I will say on this question of what could and what should Congress do, sort of again, at its heart, this case is about the individual mandate itself. all the other provisions just hinge on whether the mandate is constitutional or not. And so it's not like Congress would have to go back and reenact the entire ACA. It could just really fiddle with the mandate. And I think that's where the emphasis will be. The way we've sort of talked about it is we call it save, sever, or sink, which I think is a useful phrase to kind of keep in mind. Congress could save the mandate by dialing it, you know, the 2017 Congress dialed it down from $695 to zero. You could dial it back up using budget reconciliation. You could sever it by adding a severability clause to the ACA. Maybe that has to happen before the Supreme Court decision rather than after, or you could sink the mandate. You could actually go in and strike that provision, clean up all the cross references. I tend to agree with Tom. I think politically, maybe that last option is most preferable rather than increasing the penalty again or something like that. But the focus should be on the mandate. I think where these other provisions would come in, and I think what Tom was suggesting, is if the ACA really is at risk, it would set off, I think, a bit of a political crisis where you would have a lot of negotiation around what are we going to do, what are we going to keep, how do we want to tweak the ACA, and I guess I have real questions about whether Congress would be able to come together and actually respond. But would be curious what Tom and others think too.
Tom, Sarah, Jamila? Oh, you're on mute.
I'm
mute,
sorry
Tom.
that I should be off mute now. Yeah, I apologize for what I don't know what happened before. I was only making the point to reinforce not just an impact on uncompensated care, but also in DISH, Medicare and Medicaid DISH.
Got it. I see. Well, let me ask a question of Jamila. And you described very eloquently how the ACA has helped bridge some of the health disparity divides, and what would happen if the ACA was struck. Can you talk a little bit about, would this impact be immediate in terms of erosion of all the progress that we've made? And then what are some actions that states and other healthcare entities could take outside of the ACA to promote more equitable access to care and health equity generally?
That's a great question. I mean, under the most kind of dramatic scenario where the court decides that the ACA is not severable from the mandate and that the mandate is unconstitutional, and therefore the entire ACA is, the impact would be quite immediate as far as the impact on Medicaid beneficiaries, just because the funds that are, that are making Medicaid expansion possible would no longer be available, right? And that would have some pretty direct and, both short-term and long-term consequences for Medicaid as a program. I think that, what states can do is, well, what states would do is going to vary dramatically across states, because states have differing levels of incentives and interests in actually doing anything to try to address the inequities that would emerge from an outcome like that. But for states that were so inclined, I think that there are a number of different options, some of which might be sort of directly in response to the kind of status of the ACA and a direct attempt to try to address it. So states could decide, for example, that some level of Medicaid expansion they wanted to continue on their own dime, although that would be tremendously expensive for states and likely unsustainable at the same levels that we're seeing now. But they could decide that they wanted to continue to cover some of the population, the expansion populations, to some degree. And then I think even outside of the kind of immediate purview of the ACA, states have a really wide range, a suite of options at their disposal in terms of how to address issues of health equity, especially with respect to race. And so it's almost difficult to know where to begin, right? I think that we've seen some states already doing some of these things, right? So states like New York that have taken steps to provide health insurance to undocumented immigrants, many of whom are from communities of color, and that falls in many ways outside of the ambit of the ACA, but states have decided to do it on their own terms and on their own dime because it's something that's important to them, and that has implications for racial equity. And And there are lots of examples of policies like that, that's steps that states could take. But it's important to point out that there's a lot that states can do, but there are also significant limits that they face, right? In many states, in most states, there are limits with respect to deficits, for example. They can't just spend more than they have. And that means that even the states that are politically inclined and positioned to do more rather than less have some real constraints. There's a real ceiling on what they can do without some level of cooperation and support from the federal government.
Sarah, anything you want to add?
Yeah, I was just going to follow up. I was just going to follow up on the what states can do issue, and I think Tom also brought this up on the pre-existing conditions. And we have on the Commonwealth Fund site, Sabrina Corlett and colleagues have a recent piece where they go through which states already have the pre-existing condition protections in place. Only about 10 have all of them. If all of those were knocked down, only 10 states have them. 15 states have one, but not all of them. And 25 states in the District of Columbia haven't enacted any of those reforms. And so states would be very challenged to do this on their own. Pre-ACA, states did try to enact community rating, for example, not letting insurers rate on the basis of health conditions, and prices were very, very high in those markets, like New York State. So without the full package of reforms, of the subsidies and everything else, I think it would be very difficult for states to step in and try to protect their citizens.
Thanks. So this case seemed to come out of nowhere, and I think most people didn't expect it to get to the Supreme Court. Just one, and it's the third case to reach the Supreme Court having to do with the Affordable Care Act. What else is waiting out in the wings? Are there other cases that are sort of bubbling up that might make it to the Supreme Court? I guess that's one question for our legal folks on the phone. And then maybe if you can speculate, what do Republicans do if they lose this case? Do they finally accept the ACA and go on, or is there a strategy, more potential cases that we just haven't thought of yet?
I'm happy to start, and then others can jump in too. It's going to be it may be a very big health policy term for the Supreme Court in particular. So one case that they've heard even before this is called Rutledge versus PCMA, which is over whether states are preempted under another federal law called ERISA from regulating pharmacy benefit managers. So I think out of the frustration of a lack of action in Congress, states have tried to address prescription drug prices on their own. This is going to answer whether states can do that or if they're prevented from doing that from under federal law. We're also waiting to see if the Supreme Court's going to grant or agree to hear the Trump administration's approval of Medicaid work requirements, and then some of the changes they've made to the Title X program to bar abortion service providers from participating in that program to allow states to bar them. So we don't know if the court's going to take those cases yet. It'll be really interesting to see. I think one of the new dynamics of this kind of majority of the Supreme Court, where you have 6 more conservative justices and 3 more liberal justices, is it takes 4 votes for a case to be heard on appeal. The Supreme Court doesn't take every case that comes before it, it picks and chooses. And before, I think with Justice Ginsburg on the court, you had 4 votes, like a solid kind of liberal voting block to take cases or force the court to take them. It's going to be really interesting to see if, just based on the new dynamics, there are cases that might otherwise have gone to the Supreme Court or that they would have agreed to hear that we're not seeing anymore. But I think even just, and I should say there's a ton of other cases sort of percolating at the appellate level that in theory will, be before the court or could be, at least for them to consider to hear. But even just what we know is pending right at this moment, it's quite a lot, both ACA, Medicaid, Title X, family planning. There's a lot going on out there. Tom might have other things on his list.
I'd also add, I agree with everything Katie said. The 2 I'd add 340B. I think there's a chance that the Supreme Court could review the DC Circuit's decision to uphold the 340B pricing policy. And then I'd also add to that, even though it's an immigration challenge, the public charge rule, which has a real impact, is going to have a real impact on the ability of non-US citizens to access Medicaid. And we know the Supreme Court's going to take that case. They've already agreed to it. They suspended the injunctions, but they still have to assess the merits of the public charge rule. I mean, I guess
So I know we're
vote the public charge rule, but for right now, it's still pending.
nothing that's going to fundamentally affect the ACA as a whole. It's not going to make it unconstitutional. So these are all issues that might touch the ACA, but it's not going at the heart of the ACA. Well, I know we're approaching the end of our time, and I see there's several questions we didn't get to. Maybe I'll just ask each of the panelists if they have any closing thoughts before we leave. If we can go around the horn, maybe start with Jamila, and I'll work my way around clockwise.
So I would just close by saying, it does appear that the ACA will come out of the other end of this case intact to some degree, in the sense that the chances are low that it will be completely dismantled. I think there's still value in sort of pointing out what the stakes were, because it sort of puts front and center for us what precisely the ACA is doing, what precisely it's accomplishing. And, because I think, as you suggested, Liz, this is only one round in a game that has been iterative, and there's no reason to believe that it's going to stop entirely, right? We don't know quite what the composition of the Senate is, although there's I would say certainly a non-trivial likelihood that the Republicans will have the Senate. And so, there are going to be attacks on some level to the ACA consistently. There's no reason to believe there won't, because there have been for the last 10 years. So it's worth thinking about and keeping in mind what it is that the ACA is doing, especially with respect to racial equity, and whether it's in the court or whether it's in Congress, thinking through sort of the mechanisms for sort of continuing to protect and defend the gains that we've seen under the ACA.
Great, thank you. Katie?
Yeah, I can go now. I completely agree with Jamila. I think it really is important to keep talking about even the potential for the entire law to go. That remains a non-zero risk, right? And so it's definitely on the table, and folks, we shouldn't get complacent about that. It really would, wreak havoc in the healthcare system in the middle of a pandemic. So it's absolutely something to keep in mind. What I would like to think is that, the ACA will be on solid legal ground, and hopefully that would put to bed or put to rest some of these types of, I think, very politically motivated legal challenges. It is the third one that we have seen, and by far this one is the weakest. I had hoped after the big repeal fight in Congress in 2017, maybe we would be at a stalemate where Democrats couldn't improve on the law, Republicans couldn't repeal it. Maybe that was a moment, I had thought naively, to move on from some of the ACA politics, and instead you saw this lawsuit get filed in February of 2018. And so I think it is hopefully we can, see the law upheld. I think that's the right just legal decision. No one wants big broad statutes to be struck down for no reason. In this case, and maybe it's the moment to sort of move on, work on other really pressing healthcare issues, even if it's not coverage, which seems to at least appear to be continuing partisan issue for the immediate future, but hopefully it can put some of that to rest.
Great, Sarah.
I just think that the case and the arguments this week have really highlighted how the Affordable Care Act has evolved over time, and our understanding of how the various pieces have worked. I think Chief Justice Roberts' comment about, well, you told us the mandate was essential, and actually, as our experience has progressed over time, we're finding out that it wasn't that essential. That the premium subsidies really mattered the most, and if we can increase those subsidies, we'll probably get even more enrollment in the marketplaces. So that strikes me as a lesson for all of Congress, for the courts, that something that we believed would be true about a piece of legislation turned out to be, we learn over time. So legislation shouldn't be viewed as static. We can improve it over time. And I think that's maybe a way to progress and look at the future. The Affordable Care Act, the essentials are actually working quite well. And what can we do to actually make it work even better?
Great. Well, that's a really positive note to end on. Thank you to everyone. And I guess we We're missing Thomas, so we won't hear his closing remarks, but I'm sure they would have been wise and thoughtful as well. So thanks, everyone, and please take time to complete the evaluation survey that you'll receive after this broadcast and via email. A recording of the webinar and additional materials will be available on the Alliance's website. So Katie, Sarah, Jamila, Thomas in absentia, thank you everyone for joining us, and thanks to the Alliance for putting on such an excellent panel. Thanks.
Thank you.